Hello, everyone. Welcome to the October EQ Conversations. My name is Eric Pennington with the Spirit of EQ. So glad that you joined us here today, be it live or be it by the recording post. Joining me today is Kelli Schweitzer. And Kelli, welcome.
Thank you.
And maybe because I have such a paranoia about whether or not I get the last name correct. Did I pronounce your last name right?
Yes.
Oh my gosh, I did it.
Yeah.
Cool.
We're so far removed from Germany. People always want to give it some kind of German spin. I'm listening to a book on Derek Bonhoeffer right now, and I realize my whole life I've been pronouncing his name wrong because the guy who's reading the book to me definitely has German, and even after listening to it for a couple hours, I still don't say it right. But people all the time want to go Schweitzer.
Well, and it could be just again, I've kind of got that deep hidden fear that I'm going to butcher the names. But anyway, Kelli, so glad that you could join us today. Very much appreciated and looking forward to the conversation. And in our promotion of this particular edition, we had all your background and what you do, where your sort of your emphasis or your career and that kind of thing. But would you tell the audience, maybe just for those that maybe didn't get to see the promo stuff, a little bit about your background professionally and personally?
Yeah, for sure. So I've been a nurse for over 20 years. I think once you hit that second decade of your career, you just say over 20, you kind of blur it like the background behind me.
Okay. I hear you.
The majority of my time has been in direct clinical practice with an emphasis on professional development. So I went right from my undergrad to a master's, was able to do professional development. But after marriage, and when we first had our children, I stayed home. So I was contingent for years and years and years. So we do have 3 children, and I can currently say they're all teenagers, although that one is getting ready to be 20. So
oh, wow.
That will age me as well. But yes, so I've been married for over 20 years and have 3 children. And where my career is right now is as the Senior Director of Professional Practice for the Ohio Nurses Association. So our emphasis in what my department does is approving and providing continuing professional development for nurses.
Okay. Wow. Yes. Yeah. And I know that that's our sort of our path of connection on that. So Kelli, in this session, I mean, I was really excited to have you on. I don't have a medical background. However, my empathy levels are super high for human beings, and nurses are definitely in that. And especially, with where we've been in the last, believe it or not, as I know, right? Almost 2 years gone with this COVID thing. So, but before we get into some of that, I'd like to talk a bit about, where emotional intelligence has shown up for you personally, certainly within the current frame in the last 2 years. However, we know that it's not just a professional deal. We all are leading and have been impacted in multiple areas of life. So what's been most pressing, and where's your EQ shown up for you here in the most recent frame?
Yeah, I think most recently, like you say, having empathy for the fact that we're all trying to navigate a novel virus. And I think even 2 years in, it's still pretty novel. And so people's fears, concerns, frustrations, that's all real. And the fact that, those of us have been in the medical community for a long time, and we might have a little bit more assuredness, or we kind of know what to expect if you land in a hospital and those kinds of things. So folks like myself, are very much trusting and, okay, let's figure out what we need to do. And I remember early on, do you remember when nobody was wearing a mask and we were we didn't know about all that. And there was actually this conversation around, well, the healthcare workers need the masks, and people started making them and everything. And I just remember how much we had to pivot very quickly and how the information was coming at us very fast. And it just reminds me of, I started my nursing career on the heels of when we kind of knew more about HIV, but I was being trained, and the knowledge base of my professors and things was still they were remembering the earlier days where you didn't know a lot. And then and things didn't move quite as fast with that. But that's like the most kind of novel thing in my lifetime that I can recall. You know, we had SARS and we, you know, things like that, but we kind of knew some things. Like, you know, when we had the Ebola scare a couple years back, we had some knowledge base, at least what we might be able to expect. And this kind of feels like that like we don't know what to expect. We're very scared about, you know, what's coming at us and how fast things are changing. And so I think that it's really good to be thinking through like, okay, how can we come alongside people and how can we have honest conversations while at the same time understanding where we stand and what we want for our loved ones and, you know, what we consider safe, but also understanding that somebody may not be at that same place as us. And so trying to navigate how we can, you know, be empathetic while at the same time, also being like, well, you know, that doesn't really work for me. So if you're going to make that decision, then maybe we need to talk about whether or not you're welcome in my home, or maybe we need to talk about whether or not I'm coming to that party. And you know, it is a tricky thing because as we've seen, families have been divided and friendships and all those kinds of things. So how do you navigate this well without destroying relationships while at the same time doing what you need to do for your own health and security?
So within that, and I'm going to come back to the family division thing, but was there anything that surprised you in this most recent? Was there anything where you kind of get, whoa, I didn't expect that?
Like, even though we've had some discussions and things in our country about vaccines for years, the I'm going to say, it's talking about saying words wrong. The politicization, I'm not going to be able to get that right. We'll probably talk for a half hour and I'll never get that word right. But putting politics with vaccines that's been interesting. It's been interesting how, you know, I love June. Do you remember June? When those of us who could get vaccinated were vaccinated and the masks were off and we went to the grocery store, there was no mask. There was like this little bubble of a second. I think we really love that so much. But then as I saw the summer going on, and I and my husband decided, I think we're going to go back to wearing masks, even though they tell us that we don't have to. That was interesting because I remember the signs then were, you're vaccinated, you don't need a mask. If you're not vaccinated, we request you wear a mask. So then I was like, they think I'm not vaccinated. It was really an interesting place to be. But then realizing, like, does it matter that what this person that I don't even know and probably won't ever see the rest of the week is like thinks about me right now? I don't care. But that was surprising to me. Just kind of like it's that whole thing around, wait a second, these things that I love, vaccines, I love them, you know, like I've seen what they can do in populations and in my own family and things like that. And then to be like, wow, there are people who have put some politics behind this, and the conversations get very heated. And that has been that has been interesting. And it's been interesting to see that just kind of a lack of trust. And then also, I think we've known as healthcare professionals that public health is not, it's fragile. I think we've kind of known that, but to see the fragility really firsthand, and the things that happen here in Ohio with our public health director at first, and those kinds of things, that was really surprising. It was very surprising.
Yeah. And that's, it's interesting because, and I think we talked about this offline, Kelly, my mom, thankfully is recovering from COVID pneumonia. And she was right in the middle of the, sorry, we're having like 48 hours to even have a bed available type thing. And one of the situations when I went to see her, it was at least here in Ohio, the typical approach was, okay, you're allowed one visitor only. That's it. Only one person. And I was that person. And I remember the first day that I went to visit her, you know, keeping in mind that my mom is well along in years. So, I mean, she was in a high risk group of people. And it was a little it was fraught with all kinds of, you name it, fear, sadness, the whole deal. And I remember going in and the first time, and I remember the nursing manager, that floor, and I may be getting the language as to their role, but he was the one that was in charge, I guess is probably the best way to say it. And he looks at me, Kelly, with this sheepish type of look and hesitation, like almost like and he goes, would you mind? We need you to wear, I had to wear gloves. I had to wear the face shield along with the N95 mask, along with a gown. And I looked at him and I go, oh my goodness, I bet you he's encountered one of those, I'm going to use my language, nut jobs that told him that, hey, my constitutional rights say I don't have to do this and you can't infringe on my, and I immediately, Kelly, went, hey, it's okay. I just want to see my mom. And it just really dawned on me when you mentioned about the politicization. See, I missed it too. I'm sure someone will write in, please, we'll accept that. It has become so political. And I think the sad part about that is that we're talking about human lives, not about an election.
Yeah.
But I want to kind of go a little bit in that direction as it relates to what you're hearing, because I know you're not in the actual practice in the hospital nursing now, right? So what are you hearing? What are some of the things that the nurses out there in the association in Ohio that are saying, this is what's the weight on the shoulder, if you will?
It's the amount of death. It is, I did ICU for a little bit. Most of my career was intermediate. Mm-hmm. And hearing ICU nurses, like when I was in the ICU, I was in a neuro ICU. So if people are there, they're really, really sick. And, we dealt with brain death and those kinds of things. I'm trying to recall, I worked full time in a neuro ICU for 2 years. It was a long time ago. So, it's revisionist history in a little bit of way, but I want to say you figure you work 3 12s a week for a couple of years. I think I can recall 5 or 6 patients that died, and that could have just been maybe a colleague of mine might've had 10 in 2 years, whatever. Right. These men and women, it's daily that someone, whereas normally as an ICU nurse, yes, you have a critical patient, but one of the really great things is being able to transfer them to the intermediate folks or to the floor. You never really, typically if someone's critically ill, you don't discharge them home. It's very unusual for that ever to happen. Right. And just the amount of death. And then to your point, there have been times during the pandemic where there's no visitors and dealing with, that you are the only person there when someone is breathing their last breath, that the family member can't be there, or you're using, an iPad or something. That has just been really taxing and really weighing. And although for years and years and years, we as nurses, depending on the infectious diseases that patients have, we might be garbed up, but we garb up, we come out, we go to a different room. This whole wearing all this gear all day long. And then 2, before the vaccine, the amount of fear to go home to your family, again, novel virus, we didn't know a lot. There were nurses that were staying in hotels for weeks on end because they were fearful of their young child at home. I was pregnant and nursing for all 3 of my kids. I can't imagine being pregnant in this environment and caring for this type of illness and not knowing, those kinds of things. So I think that, people understanding that, I always hear this line, well, if I get COVID, that's on me. That's kind of been no, it's not just on you. It's not just on you. It's the healthcare system strain. The other thing that's really surprising that we haven't seen before, that I remember hearing early on when the virus was first in China, is the amount of people that aren't able to access healthcare that normally would have. So, think of all those months that we didn't have elective surgeries. So if you were waiting for your knee surgery, you know, you busted your ACL and you're waiting for your knee surgery, you're not getting that for 7-8 months, those kinds of things. But the other thing that has happened is, okay, so with COVID, you hear a lot about these extraordinary measures, these treatments that we need to do. One of those is an ECMO machine that used to be, you very seldom had that. Like, you know, and some of the patients who needed that were patients who were like, patients who are waiting on a heart transplant per se, say.
Right. Nice.
So things that we used to be able to bridge patients and, you know, till that heart transplant, they're dying at home. There's not a bed for them now to come in because there's these acute sick patients. And I think that's what's been so surprising too, is that just because we're so good at the hospital of like, you come in, we'll fix you and we'll send you back out, you know, people are starting to realize that like, well, that's only to a certain point. And when you have this much stress on the healthcare system, and then when you have this much stress on the employees that work there, they're being like, you know what, I could go work at a bank and not have to do this anymore. Or I could go, you know, be something else, or, and that's what's happening.
And Kelli, it's interesting. When we just posted an article on our LinkedIn page from the Washington Post about the term of the Great Resignation, I think is.
Yeah.
And it's a really good read about that there's all these different categories of why people are quitting, leaving positions. And the one that really leaped out for me was that some folks, basically this pandemic has caused an awakening, and they begin to kind of look at life a little bit differently as it relates to, is it worth it? Do I really need to endure all these various things, some of what you mentioned, some outside of that? And, you know, obviously in the work that we do, people making better decisions with their life is the mother's milk, if I can say it that way. It's the crown jewel. We want that for everyone. I think there's this dynamic, which leads me to the kind of the next thing with, if you could identify a few of the emotions that you see and hear from the nurses, the ones that maybe they are coming to you for continuing education and coming to you for information on how to navigate a system within continuing ed, those emotions come with them. So I know fear is probably one. Are there any others that you would say, man, really leaped out for you?
Frustration. You know, frustration is probably, you know, because, you know, one of the things that I think it's not unique to nursing, but I think nursing does have this like unique identity thing that we have. You know, I think that a lot of times when people become a nurse, I mean, I always say when I'm like training new nurses, I'm always like, you used to be a civilian and now you're a nurse, you know, kind of like how the military does, because there is this concept of that's hard to understand unless you are a nurse about we're constantly assessing, we're constantly, you know, looking, trying to think, okay, what's up with that person, you know, like when I just remember a friend years ago, she was like in the grocery store line behind somebody and she tapped the guy on the shoulder. She's like, I think you might want to go to the dermatologist. I think you have a little skin cancer. You know, that's not normal. Normal people don't do that. You know? So I was like, seriously, lady? But yeah, so I think like this whole frustration of, you know, to me, like the lack of health literacy in our culture is really come to fruition. Like we need to do more. We really need to do more. And that's not going to get fixed immediately. I think too, the frustration over, you know, we've always known that resources are not equitable in communities. So, you know, some of this like lack of a bed might be true in certain areas of our city than others, or certain parts of our state than others. And that's very frustrating. I think the other emotion is just sadness, you know, really, I mean, just extreme sadness. And like you said, with the Great Resignation, I find that, you know, in nursing, there's always been this, you know, we have a shortage, we have a surplus, we have a shortage. Early in my career, there was always the shortage surplus. It was like on a 3-year cycle. We don't get the surplus anymore, very, very rarely. And part of that is we had a huge baby boom of nurses. You know, we had the baby boom generation. There were a lot of nurses and things like that. And as they're aging and as us extras are aging, you know, another thing that happens is like certain things you're just kind of done with your profession. So for some, I remember when we first got electronic health records in the hospital, there were some that were like, peace out, I'm good, I'm done. I don't want to learn one new thing. And that's been a little bit here too. It's like, I'm good. I just really don't want to do this. I've had enough of this pandemic and enough of what's being asked of me. And, you know, it goes from, you know, clapping and standing up for your healthcare heroes to, you know, people yelling at you in the grocery store because they disagree with how you feel about vaccines or masks or you name it, you know.
Yeah.
And, you know, you can be frustrated on one level, but then also very sad for the state of healthcare in our country. And, you know, the ANA has asked for federal assistance with the nursing shortage and things like that we need to look at, that this is a real problem. But, you know, for me too, it's not only a problem for nursing. I mean, respiratory therapists, you know, nursing assistants, obviously our coworkers. So I think this whole, just frustration and sadness, I think are the two that come to mind most often.
So do you think, Kelli, you mentioned about literacy. I've always been one to say that, you know, one thing that the COVID era has exposed is our unwillingness to take care of maybe the greatest operating system ever known, called the human body, mind, right? And there's a lot of irony in that, I know, because you'd say, well, wait a minute, that doesn't make any sense, because in the United States, you're the most technologically advanced country on the planet. You've got access to anything you want. You have prosperity like history has never seen. And you mean to tell me you guys are in that bad a shape, right? And the truth is, yeah, we are. I mean, you know, I kind of go to these things and I look at them maybe more from a deeper emotional level, that when I see that the top comorbidity is obesity for COVID, and I'm going, that's in our control in most situations. I mean, I understand there's exceptions, truly. So I get that. But for most of us, obese or not obese is in our hands. It's in our control. And Kelli, I know you know me, so you're not. You probably get this. This is not my, you know, statement that your BMI should be at a certain level or you're a failure. Okay, it's not that. It's just, I think the evidence is overwhelming that we really don't value our health, and which I think leads to that literacy thing. Does that make sense?
Yeah, and I think a lot of times too, like I said, I think we put a lot of stake in the technology of our healthcare system, and we just tend to think, well, they can fix me, you know, and they can do this, and you know, luckily there has been some level of trust in that, but I think that it is amazing to me that like we live in these bodies, but we know very little about them. And then as a parent, it's been interesting, like watching what my kids learn at a young age, that I'm like, but wait a second, why are we talking about mitochondria in second grade? Like, why aren't we just talking about like lungs and how you breathe? Like, why? Like, it has been interesting, like what little they like you learn unless you really want to learn it. And just things that I feel like should be more, and you know, me as a parent could be teaching that, right? I mean, like,
I get it totally. I'm with you. I'm in your tribe.
And it's only through me, like again, the civilian to a nurse thing. Sometimes you don't realize what people don't get. Like I was super excited when my one kiddo, he's now in anatomy and physiology in high school, and I kind of pushed him in that direction because that's been really interesting. My husband really liked anatomy and physiology, but that wasn't even an option for me in high school. I didn't get that till college. So, you know, like what the opportunities for health literacy, and then the opportunities for health literacy, depending on your socioeconomic status, are vastly different. And so I do think it is one of those things that I always say, I'm going to do that. My second chapter of my life or something is be more involved in that. And it does feel like something that we really need to do, because one of the things that I realized with like traveling internationally and doing nursing in other countries is sometimes other countries have this better, like the community health worker going out into the community and teaching toothbrushing or hygiene or, you know, different things like that. Like this level of knowledge that some people are given to go disperse, I don't feel like we have a good handle on that here sometimes in different populations. And I wish it were better.
Do you think it's a case of sort of misalignment of priorities?
I think it could be. I think, yeah, because I think, you know, there was, you know, remember, like, it seems like we get in these like trends in our culture. You know, there's a real trend towards STEM, but not so much a trend towards healthcare, you know, science knowledge. You know what I mean? Like there'll be this like push. And you know, sometimes there is a trend towards, you know, art and literature, but I don't see a real conversation about, you know, when you go to the doctor and you don't understand something. Like I felt this way when my children were little. Like, could there be a developmental specialist at the pediatrician's office, please? Because he's looking at them or she's looking at them medically, but I'm seeing some stuff developmentally that I have questions about. So where do I get those kind of answers? And you know, me being a person who had the time, I was a stay-at-home mom, college educated, those kinds of things. I would often say to my friends that, like, how does someone who's a single mom, who's, you know, needs to work 50, 60 hours a week to put food on the table, how does she navigate this? Because I'm having a real hard time navigating this need that my child has and figuring out, like, learning about it, reading books about it, all that kind of stuff. Like, how does someone else with less resources, how do they accomplish that? It blows my mind. Like, yeah, so I do feel like sometimes with the priorities, sometimes we can fix everything, which obviously COVID, we're having trouble fixing it. And so we ignore the fact that there are people who maybe never engage with the healthcare system because they don't know they should. Think about like the level of diabetes, obesity, all those kinds of things. Like, what if they would have gone to the doctor sooner? You know, because some of that stuff is linked to like hypothyroidism and things like that. And, you know, what if they would have sought medical care sooner? Maybe this wouldn't have been as much of an issue, but they didn't know to, you know?
Well, you know what, Kelly, it reminds me of my son has an autoimmune disorder. And when he was in high school, we had I think they called it a plan, a healthcare plan.
Healthcare IEP, I think there is
yes,
something along that level. Yeah.
Right. So he had that. And part of it was, hey, if my son asks to be excused, it's not just because he wants to go roam the halls. So there was a particular teacher that basically just pushed back and said, no, sit down, that kind of deal. Well, she wasn't a bad person. It didn't turn into anything huge. However, both my wife and I were like, wait a minute, this is why we have this plan. And the responsibility of you, and I'm talking to this counselor, and I'm saying the responsibility is for the school to make sure his teachers understand. Somehow it got missed. And of course, Kelly, as you know, and the audience knows, emotional intelligence is what we do here. And I remember looking at him and I said, you know, it's interesting to me. You guys do anything around like teaching or educate or whatever you want to use about emotional intelligence? Because it seems to me like this is a case of not just intellectually not getting it or missing it, but having those cues that says, wait a minute, there's something else going on here. Maybe I need to, let me pause instead of being frustrated that this kid wants to leave the classroom. And Kelly, and again, nice guy, no indictments. He just looks at me and goes, you know, no. But you know what? If you want to send us something, and I remember going, no, I don't expect the school to adopt our emotional intelligence programs and everyone must know. But it did make me realize that, you know, maybe one of the reasons why some people don't know that you shouldn't partake in alcohol when you're whatever is because it's just not really being taught.
Right.
It's just not really being brought up. And
Yeah.
I mean, it's mind numbing. When I think about how many resources we have at our disposal to do that. All right, so we talked a bit about the frustration that nurses are encountering, and maybe leading into some of those other emotions too. So, Kelli, I mean, I know you don't live in a bubble. I know you're not made of Teflon. I've known you long enough to know that you care. So how have you been helping Kelli when you're encountering people that are coming to you frustrated, sad, and on?
Yeah, I think that, trying to figure out ways that we can come alongside and advocate. Making sure that we do know what our statute, our law around, like, can we bring in other nurses to help out to ease this burden? Do we have an emergency plan here in Ohio? We do, because there was a lot of confusion and concern early on with, like, will we have enough staff? Like, do we have to do something special? Things like that. So we do have that, coming alongside of people who are, like, having to learn, because, like, in my profession, where it's at with professional development, there's a lot around conferences and, educating and all this kind of stuff. Is like, people needed to learn Zoom. People needed to learn how to engage learners in a different way when you're not in a room. Coming alongside of, how can we get supplies? Early on, there weren't enough N95 masks. Even in the hospitals, they were having supply chain issues. And so we as an organization, we're kind of working with that. And then too, like, one of my main concerns has been for the students who are in nursing school, who their clinical experiences. And so trying to think through that, and, is there any resources that we can help out with? So, like, we've done some education for clinical instructors, things like that. So just trying to, like, look at the sea of need, because, there's always a sea of need, and, like, where can I intervene? Because it can get overwhelming to be like, wait, there's such a sea of need, I can't do anything. So, just we try to be an advocate and a resource, and also an example of how to do things. So, we've obviously had to pivot and put all of our education online as well. So we're trying to do that as best as we can, and be an example of how you can do things differently, those kinds of things. And so that's been, like, the main thing. I think our advocacy at the State House has been good, as well as, just trying to also be a source of, we talked about health literacy earlier. We've actually worked with a media expert on how can we as nurses be advocates for media literacy. And in this time where it's hard to navigate where you get your truth sources from, and do I trust this particular journalist, and those kinds of things, really advocating for reading multiple sources of information. And at the same time, trusting those folks that you've trusted for a long time, like going to them and asking the questions, and then trusting what they say, can be difficult for people. But that's what we're trying to do is put out truth. We've had a really great increase in our Facebook following. So while we have 10,000 members, we've got, I think 20,000 on Facebook. So nurses are seeing us throughout the state as a resource. And then also we're trying to educate nurses and how they can be the best resource for the public as well.
So, Kelli, I'm going to bring up the dreaded term self-care.
Yes.
And when I say dreaded, I'm saying it in the context of, I was reading another article about one of the frustrations that employees have is that their employer basically plops down in their lap a package of self-care and just says, here you go. Yep. I'm helping you with your self-care. And their cry, and I totally get it, is you're not even factoring or considering what I consider to be good self-care. So in that sea of confusion, what are you seeing in Ohio as it relates to our nurses taking care of themselves? Are they finding places to get the help? Are they isolated? What's your pulse on that?
Yeah, so that's a really difficult question to answer because honestly, I think it waxes and wanes, right? Like I think the main thing about the whole self-care conversation within healthcare, because so there's this quadruple aim in healthcare, and the fourth piece of that is the health and care of our medical professionals.
Right.
Because if our medical professionals are not taking care of themselves, then the whole thing's just so, but like you say, it becomes this kind of carrot or nugget that sometimes healthcare employers will be like, well, here's a moment of self-care. And the employees are like, well, I didn't get to go to the bathroom in the last 8 hours and I ate my lunch in 2 minutes,
Yeah.
So really you're talking to me about go out and get self-care, but these other things that just don't kind of compute with that. And stopping mandatory overtime has been one of our main things of our organization. Having good staffing levels so that folks have the capacity for self-care.
Yep.
I'm a real advocate of financial, having some competence around financial things so that you have the capacity for self-care as well.
Right.
We've seen this thing in our country of huge amounts of student debt, those kinds of things. Well, as you know, some aspects of self-care are free. You can go out in the forest, you can take a walk,
Yeah.
you can, I love to take pictures of nature when I'm out on a walk and things like that. That really fills my soul and it's completely free. But other things that are fun and, help you with a little self-care, like, wouldn't it be nice to have a housekeeper maybe? I'm working all these hours, but can I afford that? There are things that do take some money. So I think a lot of times when why we get frustrated and upset when employers are saying these things is you can talk all you want about self-care, but do I have the capacity for that right now?
Yeah,
And
that's
I think
great.
this is one of those things where a knowledge base of emotional intelligence is really key and something that we need to be doing at younger and younger ages. And also taking time for is that when you have that emotional intelligence, you can speak up in that matter rather than just being like, well, I quit, this place doesn't understand me or whatever. Yeah. Could you speak up at the meeting and say, I hear what you're saying, and I get that you want to communicate care for me, but what about this, this, and this? When you say this is real loud over here. That's not meeting my needs. So you can throw out all you want, that $10 Starbucks gift card or whatever that I'm supposed to go get a coffee later. But I just worked a double shift because you couldn't find another person. So.
Yeah. It's interesting to me because, in the work that we do, there's all these competing interests, right?
Yeah. All the time.
The pandemic certainly brought an awareness to the work that is emotional intelligence, and there are other facets of that development work. But one thing I think, and we have to remind ourselves, Kelli, that this is we didn't get to this place overnight. It was a gradual, sort of that indifference to the idea of working on oneself. Yeah. And what we've had to do, Kelli, is kind of go, okay, we set the judgment aside about how you got here and why you're here. And we need to measure what's your willingness to move forward in a different way. Mm-hmm. If your willingness is high and your commitment is there, then it doesn't matter what you did 10 years ago or forgot to do 5 years ago. What we have to get out of the equation is we need to tell those other folks who really are not authentically interested is come see us when you're ready. No judgment, just come see us when you're ready. Because if you do it now, you're just throwing your money away, because this is about real change. Because your example there about that person speaking up in a meeting, that's a huge, crucial conversation. Yep. Huge. That not only impacts that person speaking, but it impacts an audience of people that may not even know the meeting's going on. Right. I mean, if you're that HR director or the head of HR or whatever your role may be, and you hear that oh my gosh, we never really considered the fact that what is your capacity? And then they begin to start to dig deeper into capacity issues. And then it changes the program. And then all of a sudden, a year and a half later, someone who had no idea the meeting was going on is getting a self-care type of program that works.
Yeah.
But just think, Kelly, what if that person says, oh, I'm not going to say anything because they're not going to listen, or I'm not going to say anything because I'm afraid. I don't know what they'll say, you know?
And to those who are fearful about speaking up, you know, because I'm pretty loud, I think.
I wouldn't have said loud, Kelly.
I sometimes feel like yeah. So I think there has not been a time where I have not, where I have spoken up about something that I feel, you know, needs to be said, or I ask the question. You know, that's the other thing too. Sometimes it's just asking the question of like, you know, help me understand, or, okay, I understand, but, you know, I have this question based on that people haven't come up to me later and said, oh, I'm so glad you asked that. I wish I would have asked that. And I'm like, yeah, why didn't you ask that? You know, like you could have asked it too. And then, but then that's the also point of someone who can be loud and ask questions, is also to sit back and allow other people to speak up and ask questions, and also coach them after the meeting, maybe, you know, like, oh, you know, you wish you would have said, so let's talk about why you didn't say, and how could you do that next time? Or do you want me to go to that person? I'm not one for triangles. I'm really more for, you know, if you have an issue with somebody, I want to give you the wherewithal to go do that. But there are times, because people need you to come alongside them and maybe go to that person, or you might know that person better. And so, you know, you might be able to soften it. But yeah, I think that knowing when to speak up and then how to speak up is something that is difficult. And there are certain temperaments that are just more inclined to that. But again, for those who struggle with it, like I feel there's a lot more people sitting out there with regret of what they didn't say than people wishing that they hadn't said something. You know what I mean? Like there are times where like, oh, I wish I would have said it that way, but I got it out there. Okay. You know, and
I agree. Mm-hmm. So as we're coming up on 12:45 Eastern, I always want to kind of be monitoring, see if we have any questions from those that have joined us. But Kelly, could you speak a little bit, and I'm going to view the chat here for a minute. Yeah, that's interesting. Katie, I'm sorry, I'm calling her Katie. She strangled me for saying that. It's Kat. She had to leave, but she did indicate that there was a COVID conversation that she had with her parents and was appreciative. Wow, that's great. So no real question there, Kelly. Sorry, as I'm terrible at multitasking, as you.
It's hard. It is hard to read a chat. It's very.
Yeah, especially for my eyes. But here's what's interesting. You know, you mentioned even earlier on about when you got into nursing, and I think about the priority thing again, and how, you know, so much of my time and you and I are in the same era where we are, I guess we'll say, confessed Xers.
Yes. There's so few of us. We should be proud.
Yeah, and I know.
We're the generation that gets forgotten. There's boomers and then they say millennials.
Yeah, I was going to say they just leap right over.
And then they make fun of us for saying, wait a second. We can't win. We just can't win.
Right. So what's interesting to me, there's so much emphasis on career, work, and all the trappings that come with it. And I always have told people, my typical story around that is I call it my Solomon moment. And Kelly, I'm pretty confident you know what I'm talking about when I mention Solomon, and maybe most in the audience do too. But just for those that aren't, Solomon, the great king of Israel, considered to be the wealthiest king that has ever walked the planet. I think I even read somewhere that if you took the wealth that he had and translated that into today's dollars, you could take Bill Gates and Warren Buffett together and they still would be far short. which blows my mind. However, one of the things that was fascinating to me about him is that he did chase after everything and he did get it. And he was the one that said, this is futile. This is like chasing after the wind. And if you can imagine, could you imagine trying to chase the wind? I mean, and someone saying, hey, Kelly, Eric, you're wasting your time. You don't chase the wind. And I think back, not from a perspective of regret, but maybe hope for those younger people who are going into nursing school or going into business school. It's like, be careful in how you handle this thing called your career. Don't let it become something that it was never intended to be and can never deliver what you might have been told it will, because it doesn't. And I mentioned it that way, Kelly, because I think maybe could that possibly be one of the stumbling blocks for some of these issues that we've talked about?
Yeah, I think identity is really an important aspect of who we are, that I was in my 20s before I realized the importance of, if all this goes away, who am I at the end of the day? Yeah. And I had a lot of stake in my career, in my, relationships, those kinds of things. And yeah, like it is all fleeting and it's temporal and those kinds of things. So really having that time to reflect and be like, what if, and I, it didn't totally take me out of my career, but I do have a health thing that like bedside nursing is not in my wherewithal anymore. Right. And that was really hard to be like, I don't have the strength to do this anymore. Mm-hmm. And, it kind of admitting that to myself and being like, it's okay. And I think it is one of those things that the younger you are and the more time you give yourself to work on those kind of, identity issues that you have, because I think a lot of what we have in this country is we do have the capacity to be such an individual, and we have so many rights, and we have, amazing opportunities that we have. But yet there's also this aspect of like, yeah, but at the end of the day, are you okay with just your own skin and who you are? Or do you need that job? Or do you need that relationship with that particular person? Or, as your kids get older, are you trapped in this, wait, what am I if I'm no longer a mom of an elementary child or whatever, really thinking through that is really an important investment of your time. Because what often happens, that I've seen happen as people get older, is sometimes just circumstances strip all that away. And then that person is left in their home alone with maybe themselves through no fault of their own. People pass away, whatever happened. And, are they okay with who they are as a person, with their own identity, or are they just shattered because no one sees them as the CEO or whatever it was anymore?
Oh my gosh. Yeah. I mean, and, at the end of the day, Kelly, it's not the only path. It's one of the paths that we take to ensure that we don't get into those traps or to walk in that field full of mines, right?
Mm-hmm. Right.
We're kind of aware of it. And it kind of leads me to it's becoming our standard ending question for our guests. So, and I know I prepared you in advance a bit for this, but it's funny to me, when you think about who we were 20 years ago, 10 years ago, 15 years ago, and the experiences that we now have. And I do believe that this COVID era has really, for some, I would consider it to be in that group where it's really kind of lasered in on, okay, what really is most important to me? What do I really want to, why am I here type thing? So Kelly, if you were to whisper to your younger self, and you can go back as far as you want, but please do tell us what person you're talking to, as far as, was it when you were a teenager, young adult, whatever, what would you whisper in their ear? What wisdom would you whisper in their ear?
I tell you, it's so funny because you forewarned me, but then you've distracted me. So I'm not
terrible
really,
host. I'm so sorry.
I'm not really prepped, but I do have an experience that most people might not have had. So I've actually had kind of this insight earlier. So I had an engagement that broke off a couple of months before the wedding.
Oh my.
Yeah. And I'll never forget what the minister who was going to perform our ceremony said to me. He said, I wish I could take a book of your life and put it forward 100 pages. And that was like the best thing that anyone has ever said to me, because it was like, just like, I think maybe, and before that, I had some interesting situations that you think will never end. Or you have the circumstances, like my mother passed away when I was in my early 30s, and there's times where you think, how will you ever overcome this? And I think to whisper to your younger self, like, you will, but also to surround yourself, for me, that means a faith community as well, but surround yourself with people that you can rely on, and you can get through it, because life is hard. Life's real hard. Like, like I had a grandmother who had just like one of these lives that you're just like, oh my gosh, how did she put one foot in front of the other every day? And I have family members who've had really traumatic things happen to them. And it's like, that book of your life will move forward 100 pages, and there will be sadness and happiness and all those things mixed in between. But surround yourself with people who can help you and come alongside you. I think, because I wasn't real good at that when I was younger. I did really invest in the one person and really invested in, those kinds of things. But
you know what, Kelli, that is selfishly on the part of Spirit of EQ, because we talk about that so much, about the importance of community and the importance of not allowing yourself to go into isolation.
Yes.
And there's an old analogy, a story that was told to me once that supported that vividly. That if you think about in the animal kingdom, lions and hyenas, mortal enemies, right? Most everybody knows that. All you have to do is watch
Lion King.
Earth. Yeah, or Lion King. Yeah, even better, right? And mortal enemies. And if you take a lion taking on a hyena one-on-one, it's not really a contest.
Right.
But the hyenas are very, very shrewd. They're very, very smart, if you will. They go after a lion who is isolated and overwhelmed.
Yep.
Because they cannot defend themselves sufficiently to protect, to defend, and on and on. And I find that to be so true for human beings as it relates to what you just said. Because these events, these circumstances of life are going to happen. They're just going to. They're going to happen to Kelli. They're going to happen to Eric. They're going to happen to the president, to the fill in the blank. Nobody gets a pass. But wow, for those people that have invested in having people around them, people that come alongside of them, so much better able to withstand that storm, right? So absolutely. Thank you for saying that. And obviously I didn't coach you to say that. So it's even more, it's just beautiful. Kelli, we're coming up on 1 o'clock. Oh my gosh. I do so appreciate you coming on. I've enjoyed it. We've had so many conversations that were never recorded. So I know. Being able to put these out here for our audience, I think is just awesome. And obviously the invitation to come back, because we'll do it again. Okay. Well, thank you. I appreciate it. Thank you. All right. Welcome. I was going to say welcome. See, I'm so off of my game here. It's all good. It's all good. It's Blur's Day in COVID world. So yes, there you go. It could be starting or finishing. You know what it is though, Kelli? It's that minister and forwarding your, how did he say it again? He said, I wish I could take the book of your life and move it forward 100 pages. That's just profound. Okay, now that I've got my legs back underneath me here, thanks everyone for tuning in. We look forward to seeing you next month. Take care. Take care.